So, welcome to Synchronised Care in Action. Before we begin, you'll need a notepad and a pen. So, if you haven't got one already, just hit pause on the video and go off and get that and then come back. So, before we start talking about synchronised care, I want to share with you Jessica's story and where it all began for me. So Jessica, as you see in this photo, is a mini Dachshund. She wasn't just my dog, she was my partner in crime, she was my best friend. She was my first chance at really looking after someone other than myself as well. So she came before I had my three lovable children. She was my lifeline actually in many occasions. She got me through various bereavements, she got me through my first heartbreak. When it comes to developing my own compassion, Jessica was the biggest teacher when it comes to that. So she was a very significant role in where I am today. She played a very significant role in where I am today. And when it comes to grooming, obviously I wasn't a groomer when I first brought Jessica home, but eventually ended up in that industry. I was so happy to kind of realise just how sorry, if you look at me on the screen, Honey's just, Honey, this is my other mini Dachshund. She's just kind of looking at me as if to say, who's Jess? So when it comes to grooming, Jessica was like the ultimate grooming model for grooming. She adored anytime I got the brush out, she was right up. She was lying kind of sprawled out on my lap. We thoroughly enjoyed our daily grooming sessions. It was a great chance to bond. It was a great chance for me to really pick up on any signs that she was maybe struggling in some way. It was just a fantastic bonding experience for both of us. And you know, she got so into grooming that I couldn't even go to a bath without her scratching at the door to get in, and she would jump in, or she would try and jump into the bath. I'd have to bring her in with me. That's how much Jessica loved grooming. So when it comes to kind of delving into the fundamentals of synchronised care, it was Jessica that really kind of emphasised the need for that when things started to change in her behaviour when it came to grooming. And I'll explain why as the presentation slides go on. But basically, when things changed, it was very subtle. For example, Jessica would no longer scratch at the door when I was in the bath to come in, which was something she'd been doing since she was a puppy. Things like when bringing out the brush, she no longer wanted to kind of jump in my lap. She was very apprehensive. And any time I kind of touched around her waist or anything like that, she would give me those kind of whale eyes and the kind of pin back ears and all the kind of subtle gestures that we as trained professionals will obviously pick up on very quickly, but would otherwise go undetected if you weren't in the industry and training and that sort of thing. So they were very, very subtle. And I do remember at the time when things started to change, thinking it could well be just a kind of off period where she's maybe not feeling 100% well, but things will pass. And so what I began to do is document everything. So I was documenting, things like just putting on her harness for a walk, if there was any kind of subtle cues that she was showing for that. I was looking at how behaviours were escalating when it comes to her daily grooming sessions, and I was hoping obviously for these subtle cues to kind of diminish, but unfortunately over the course of a week or maybe 2 weeks they were getting progressively worse, and that's what kind of made me feel like the next step was to vocalise those concerns to my vet at the time. However, and this is where it becomes kind of significant, I wasn't met with the response that I had hoped for when I vocalised my concerns to my vet. So I was told basically that I was being paranoid, that on the face of things, Jessica looked fit and healthy, her weight was fine, there was no real telltale sign that there was anything underlying going on with Jess. I was told that basically she was obviously just having an off period, as I had originally suspected, and that things were fine. So I was told to kind of go off and just, hopefully things would get better. Around 3 to 4 weeks after that appointment, our behaviour had escalated to the point where she no longer allowed me to brush her whatsoever. There was very clear signs that she was not interested in being groomed. For example, she was snarling, she was groaning, she was growling. That was just not Jessica. I'd never seen that sort of behaviour in her before. What I also noticed was there was blood specks kind of on the floor as well throughout the house. Now, the issue that I had with that was that we had at that point 4 dogs, so it was trying to establish where those blood specks were coming from. So obviously we had to make arrangements in order to try and find out where those blood specks were coming from. So we isolated Jess, which was awful because obviously she was so used to cohabiting with the rest of the dogs in the house, and she had to, for a short spell, be isolated so that we could kind of establish whether or not those blood specks were coming from her. And as it transpired, they were. So obviously, upon explaining those symptoms and the history, the vet that I went to see at the next appointment, I have to make a point in saying this was a different vet, had a wee bit more interest in what I had to say. So she was a wee bit more concerned about the symptoms. Now, the first thing I want to point out here is the vets that I was registered with at the time were part of a bigger pet brand chain. All right. So for me personally, I just think that, and I may be wrong, you might disagree, but I think that the kind of more corporate-led veterinary firms don't really have the heart, don't really have the animals' welfare at heart, right? They're looking at the kind of the money coming in and out. So for me, I just felt like I wasn't being heard up until that point, and that there was no consistent person that you would see in order to build up that rapport and relationship. So the second appointment I had was with a different vet. So I was starting from the very beginning and explaining everything that happened up until that point, which was wasting time. But thankfully, this vet did seem a wee bit more interested. So she prescribed me with Nutricist, and she asked me then to bring in a urine sample so that they could test that as well for possible infections. So later that day, I managed to collect the urine sample and I took it back to the vets as requested. So the following day after that, you're going to have to write this down to follow. So the following day after that, I called back, and I asked for the results of those urine samples. They had lost the urine samples and told me that I would have to come back in, pick up another test tube and go back in with another urine sample that day. So I did that. Thankfully, or luckily, should I say, they are 2 minutes down the road for me, so it wasn't too much of an inconvenience. And then later on, so I think that was quite early in the morning, and I think they did get the results back relatively quickly. So they phoned me that later that day and they said, listen, Stephanie, there actually is a high blood count in those urine samples. So we do think there is an infection there, which could be contributing to her behaviour changes and also to the blood specks. So rather than prescribe just any medication, we really want to explore it further. So if you don't mind coming in and picking up another test tube, we would like to send another urine sample away to the lab out with their practice, so that they can obviously prescribe the right medication. So that was absolutely fine. Obviously at that point they gave me Nutricist. I wasn't given her Nutricist, and that's from personal experience. I had been prescribed it before. I'd never done anything for her, so I decided not to do it until we knew exactly what we were dealing with. So handed in another urine sample, and then again the following day phoned up to ask for the results, and at that point they told me that the sample came back clear and that there was no requirement to do anything from there on, which obviously was very confusing, because to me, obviously I knew that nothing had changed between those two samples. We hadn't prescribed her anything. I hadn't been given her Nutricist. So how could that have been such a significant change? It was a total 180. So I really wasn't happy with that. And I knew that obviously Jessica's symptoms weren't getting any better. In fact, I would say that they were getting worse. She seemed to be really struggling to do the toilet at this point. And there was like tiny little puddles of urine around the house as well. So obviously I was unhappy. So this was all over the phone. So wasn't happy, decided to go in unannounced and actually speak with whoever was there and chance my luck, basically. So I went in with Jessica in the hope that maybe somebody would see me. And I was sitting at the reception, and the lady at reception called in the veterinary nurse who had a wee word with me over the counter, and she was basically just saying, like, the samples came back clear. There's nothing really we can do if the samples have came back clear. However, have you tried this? I can't remember which kibble it was, but a specific kibble for like urinary health. At that point, I was just like, absolutely not a bloody chance. Am I changing her diet, considering she's never had an issue with her diet before? And you're literally just clutching at straws. So absolutely not. So at that point, I demanded, I'll admit, emotions are heightened, you're really worried, blah, blah, blah. So at that point, I demanded to see a vet. So obviously I couldn't be seen that day. I got an appointment for the following day with a vet, and I went back down the next day with Jessica for my appointment. And I always go a wee bit earlier just in case I can get seen sooner. So I was sitting at the reception, and just a wee bit of history of Jessica and how she behaves. Jessica admittedly was quite dog reactive. So whenever she saw a dog, she was very, very vocal. So she was unfortunately faced with another dog as we were waiting, and she's barking, barking, barking. Unbeknownst to me, the vet that I was meant to be seeing, another vet, so this would have been our third vet, had been sitting drinking a cup of coffee or a cup of tea at the reception desk. At this point, I was 5 minutes into what was meant to be my appointment. So she's came walking around the counter, and she says, well, based on what I see here, she clearly isn't in any pain. So, and she kind of gave me those kind of shrugs. She kind of shrugged her shoulders and was kind of like, well, I don't really know what to do. So obviously at that point, I'm very irate, right? So I'm just not having it. I've tried to explain at that point. So I went into the wee consultation room, and I began explaining from the very beginning everything that had happened up until this point, trying to reinforce the fact that this is not normal. I have been trained to pick up on these sorts of things. I know my dog well. It's not our diet. There is something else going on. The sample initially had came back with a high blood count. I don't understand why it's not, blah, 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 blah. And she just kind of shrugged her shoulders and said, well, if the most recent results came back clear, I really don't see the point in doing another one. She was very, very dismissive. Kind of felt like she was judging me for trying to, and I wasn't trying to diagnose, but I think she thought I was. I just knew in my heart that there was something not right, and I wanted to explore it further. So at that point, I just said, that's fine. If you don't want to do anything, that's fine. I want to see a specialist. So she asked me to go and sit outside. Then she comes out and she says, well, we have got a specialist in Glasgow. They're going to, at this point, I think it was like just about closing time. She says it will be an emergency appointment now, given the time it is and the time it takes to get there. You can see them. They are specialised in kind of abdominal conditions. It's entirely up to you. And this is book me in. So I got an appointment straight away, drove up to Glasgow. At that point, and as soon as I reached the clinic there, I was met with a nice male vet who instantly, reassured me that I did the right thing. He listened to my story. He, reassured me that everything that I had like concerns about was valid. And he told me straight away, like, this is what we're going to do. We're going to take a direct urine sample from her bladder. She needs to be put under for that. So obviously there is a risk with that. And we also want to do some abdominal scans as well to see exactly what's going on. So that was the two things we were going to do. So he sent me on my way, said, go and have a coffee. It will be a good hour. And I'll phone you once we've obviously came out of the theatre room or whatever it is, whatever room it is that they do those things in. So I went away, so that was fine. It couldn't have been more than 20 minutes and I got a call back to say, Miss Zikmann, please, could you return to the surgery? We don't have good news, I'm afraid. So, the feeling that you get from that, obviously, it's like one of those ones where it's for the first time in your life you wish you weren't right, if that makes sense. Like you're kind of like gutted that you're right, that something was wrong and that your concerns were valid. So I hurried back. to the practice, and he took me into this wee room and he sat me down and he said, okay, and on the screen was Jessica's scan. And even for an untrained eye, I knew what I was seeing wasn't good. So the scan was there, and what it showed was a mass that was practically completely obstructing her entire urinary tract. So he went on to tell me, this dog's been in considerable pain. There's no doubt about it. And that it's a kind of fast progressing cancer. So it was transitional cell carcinoma she was diagnosed with. He basically told me at that point, the chances are it's spread to other parts of her body. However, we can do other tests to confirm that. But basically, he said the best you can hope for is an extra week with her. But he says he wouldn't be surprised if Jessica lasted another couple of days. Sorry, he would be surprised if Jessica lasted more than a few days. So obviously at that point now, just to give you a wee bit more context, I was 8 months pregnant at this point, so incredibly emotional, very hormonal, and I was just utterly shocked and devastated, and all of the horrible feelings you could possibly feel, all in the one go. He gave me 2 options. So he basically said, like, listen, well, he gave me 3 actually. He said, we can bring her back, you can go home and you can get as many days as you can out of her. We can give her some pain relief, but in terms of treatment, there's nothing much we can do. He says, or we can just let her, rest in peace. She's still under, so we can just add the second jag and just let her, slip away in peace. Or you can bring her back and, spend some time with her right now, say your goodbyes, and then we can look at putting her to rest. Now, I decided I wanted to bring her back and just spend some time with her. And the reason why I did that was because the last memory that she would have had in my head, the last memory she had was me walking away while she was screaming to get to me. She hated strangers. She hated unfamiliar environments, as does any dog, really. And I didn't want her to feel like I abandoned her. So that was kind of ringing in my head. I need to fix that. I need to make sure she knows I'm here. So at that point, my husband was actually sitting in the car outside. He was like, look, the chances are, yes, it's going to be bad, but there will be a treatment plan and we'll go for it. We'll do anything. We'll spend whatever it takes to make sure that Jessica's okay. Obviously not expecting to be told this. So I had to phone him and say, like, you need to come in. We have to say goodbye. And he came in and he was just as much shock as me. The vet went away to bring Jessica in, and when the door opened, it was a ghost standing in front of us. He was chalk white. Unfortunately, Jessica had passed away while under. Try not to cry here. I just remember my knees buckling, just completely, possessed by grief. It was just the most awful feeling in the world to know that she died on her own, and she wouldn't have known that I was there. So it was horrible. It was absolutely horrible. It was just emptiness. So we spent a good wee while with her before we had to go home, and obviously let everyone know, because we have obviously 2 children at that point, and we, family members looking after them and whatnot. So we had to just go home. I went offline. I went off the grid for a good few weeks, actually. I was no work, nothing, didn't even tell anyone what had happened. It was just, I couldn't speak. So anyway, the days and the weeks that followed, I just got angrier and angrier and angrier. I had a lot of, regrets as well. The fact that each vet that I saw kept dismissing my suspicions, the fact that I didn't see a consistent vet and I had to keep repeating myself, all of that was just festering inside me, thinking if this had happened, or if that had happened, or if they did that, or if they did this, things might have been different. Each vet, in my opinion, failed Jessica because they disregarded my observations and ability to recognise pain. The entire system also failed her because we weren't met with a consistent vet, right? So no relationship was established. How many other pets have suffered in the same way Jess has because of these 2 things? That's what kept going on in my head. So Why are professionals not working together? Why are they not listening to one another? Why are professionals not listening and taking into account what carers are saying? How many more animals are not receiving the care that they need because of this disconnect? And that's where my obsession to synchronized care came in. Of course, now it's too late for Jessica, but it's not too late for other animals, right? It's not too late for other families. It doesn't mean that Jessica has to die in vain either, because her story, I'm hoping, is going to kickstart an initiative to begin to start truly listening to one another more and addressing the areas in the pet care industry that need to be addressed as well. So the first thing I want to do is have a wee reflection exercise. So we're going to sit and think about the following questions. The first question is, have you ever had your observations dismissed by a pet professional? The second one is, what signs might you be seeing that others aren't taken seriously? The third question is, how do you think we can create systems where every professional's and carer's expertise counts and is valued? And then the fourth one, I can't count, is what would synchronized care have looked like in Jessica's case? Like, how do you think things could have went differently? So have a wee think about those questions, write down some notes in your notebook, and then once you've wrote those down, we can move on to the next slide. So I really want to emphasise that as much as I did initially blame the vets for Jessica's death, this is not what this presentation today is about. We're not looking to blame any individual. We are looking at raising awareness in order to raise industry standards across the board. We are looking at creating a system where Jessica's story becomes an impossible event because pet professionals and carers are all working together in tandem. There's no longer a disconnect. We're all communicating, we're all speaking, and we're all valued for our input. Because I know for a fact that it's not all vets and it's not all vet clinics that are like this. Mostly all vets want to do the right thing. Mostly all vets are proactive when it comes to trying to address underlying or unresolved or unidentified pain and illness. But I know that there are still some practices out there that are not like that. And that's where we want to focus our attention on as well. It's those other kind of minority establishments are getting it wrong, and that as a result things like this are happening every day. So really this presentation today is about accountability. It's about stepping into our responsibility as pet care providers, and it's ultimately about helping to safeguard the animals that we're entrusted to care for, because ultimately that's what it is about. That is all that we get up for every single day. It's the motivation to keep going for every single one of us probably that's watching today. All right, so hopefully you have had some time to sit and reflect upon the questions that we had covered earlier on. Let's now review Jessica's story and what it has essentially taught us. So obviously the first issue highlights significant communication gaps. For example, I was observing Jessica daily, documenting changes and identifying subtle shifts in behaviour that screamed something was wrong, yet there was no process to encourage communication between myself and the vet team. Instead, my observations were dismissed as me being overly sensitive and or paranoid. Now, I don't know if that's because of the specific and individual views of certain vets, or whether it's just this general consensus that pet carers tend to typically go over the top when it comes to trying to address things with their pets, and that kind of instantly makes things a wee bit more awkward and tense between veterinary professionals and carers. But whatever the reason is, this was one thing that I identified very quickly, was that we most often, in my experience, carers aren't really encouraged to actively observe and communicate any findings with pet care providers. They're instead kind of made to feel like they're not experienced or trained enough to do that. So there's a disconnect there, certainly, or certainly in my experience. Perhaps you've experienced something totally different. But I do think that because of this disconnect, a lot of animals aren't receiving early intervention because carers are either not vocalising their concerns or observations out of fear of being made to feel stupid, or they are expressing them, but vets are not really listening to what they have to say, or they're not identifying the link between kind of more subtle or insignificant behavioural changes when it comes to pain and how it's linked to pain. So that's the first thing. The second thing is this dismissal of knowledge as well, which comes between pet care providers specifically. Now, obviously, in Jessica's case, I was both her carer and also her routine dog groomer. Now, I was grooming Jessica on a daily basis since she was a puppy, and knew very much instantly when something was wrong based on how she was responding to grooming tasks that she used to absolutely adore. So that was significant to me. And in my professional opinion, having worked with hundreds of dogs in an intimate way through my grooming practice and also in my training with behaviour and also dog training, I knew something was wrong, and I knew that there was a link between how she was behaving and something else that was underneath the surface. However, and I don't know if this is because of there's a general consensus again that, for example, dog groomers aren't too knowledgeable on things out with styling. There's this misconsensus again that groomers don't have the right training in order to effectively and efficiently identify signs of illness or pain. And then we've also got to consider the VSA as well, and how this stipulates that non-qualified pet professionals are not or shouldn't be seen to diagnose and or advise on illness or treatment plans. So again, there's that as well. So whatever the case may be, there is another disconnect between pet care providers, and we are kind of made to feel like we should be taking a step back and letting the veterinary professionals do their job, which is absolutely warranted, of course. However, what I'm trying to say is that more could be done to help assist veterinary professionals in order to achieve early intervention. So that's the second thing. The third thing, and I'm sure you have picked up on that almost instantly as well, is that there is this lack of veterinary care stability. But this is not just aimed at veterinary care either. Obviously, with Jessica's case, it's all about kind of the veterinary approach and whatever, but it's actually widespread. So a lack of pet professional care stability should be the kind of what it should say there. And what I mean by that is that quite often a dog is not going to receive treatment and care from the same pet care provider, especially in multi-professional environments like veterinary clinics and grooming clinics as well. So it might be that Bruno, like Jessica, receives a different vet every time he goes to visit the vets, or a different groomer every time he goes to visit the groomer. And this sort of instability prevents an animal from forming a trusting relationship with the pet care provider, which essentially wastes time as well, because as we all know, working in this industry, it is essential that we achieve emotional safety with an animal, and that also includes being able to build up that trusting relationship so that you can interact safely and in a way that the animal knows they can trust. So again, with this lack of pet professional care stability, we can expect a lot more time to be wasted, because not only is the animal less inclined to cooperate, the pet carer as well is going to struggle to also build that rapport and struggle to trust, especially when you've got pet care providers with conflicting views, which I've seen often even in the same practice. So we have, vets that are a wee bit more outdated in their approach versus vets that have maybe just came out of uni and they are fresh with their ideas and more up to date with their ideas. And even in the grooming world as well, there are various multi-grooming establishments where we see a lot of groomers who are very conventional in their approach, Meanwhile, we've got newer kind of groomers coming in with training out with conventional methods, for example, through the HGA, who feel conflicted in their approach because obviously they are trained conventionally to do one thing but know better from the extracurricular training that they have received. So this inconsistent approach to mindset and ultimately approach as well can also waste time and also prevent progress. And ultimately as well, when you're seeing a different person for every appointment, you're going to have to then repeat the history to give them an idea of what's happening, which ultimately again wastes a lot of time and energy and can also build frustration and anger, as was my case with Jessica. So these are the first three. Let's move on to the last two. So lack of coordinated care protocols is basically, and perhaps, and I do know that there's a few pet care professionals in this community specifically who have fantastic support networks around them. And so this probably doesn't apply to you, but what I do find with a lot of pet care providers is they are working in isolation, whether that's because there is a reluctance from other pet care providers in an area to work together with other pet care providers from different sectors, or whether it's a simple case of they don't quite know that that's significant and that this sort of approach should be actually a baseline. So what I mean by lack of coordinated care protocols is that every pet care provider looks at their role and their expertise as an isolated event that's not connected to anything else out with. So, for example, Bruno comes to me for grooming and receives a specific approach, but then I'm not relaying what's happening in that appointment to any other pet care providers that are responsible for Bruno's care. So I wouldn't think then to contact Bruno's trainer to let them know this is a wee kind of minor setback that we've had today. Maybe look at adapting your approach for his next appointment just in case there's anything anything different about his behaviour. This is why. So it's being more open to communicating and working alongside other pet care providers and thinking of the bigger picture when it comes to synchronised care, because every single event that happens in an animal's life is connected and will influence the others. So we need a system, ideally, that aims to provide all this information in one space where it's easy to access and where all professionals that are responsible for the care of an animal can get access to it prior to their next appointment, so that they can make sure that everything's on track. There's no adaptations that need to be made, any significant events, that they need to be aware of. Now, I designed the bespoke holistic grooming planner. If I just show you what I mean by that, so this one here. In my attempt to do just that. So basically, the idea of this planner is for every pet care appointment, the events are kind of noted down in the diary log. There's also a significant events input section where if there's any setbacks or any kind of significant progress, that can be noted down as well. And the carer then takes this book to every appointment, whether that's dog walker, vet, canine masseuse, whatever, and they can have a quick look at this to make sure that there's nothing significant that they need to be aware of that might influence how their session will go. Obviously, that's not so much a convenient way for many people to have an actual online system like a database or something along those lines, which doesn't breach GDPR, would be an ideal alternative. However, this is what I've came up with. If anyone's watching this and is really tech savvy and would like to work with me on trying to develop something that's kind of more streamlined and more effective at sharing information between pet professionals, and please do reach out, because I am actually really interested in thinking of ways to make this an actual thing. But I'm going off on a tangent now. The idea, though, is that in Jessica's case, we were not all working together, and because of this, there was a delay in getting the necessary treatment for Jessica. So the last one is missing follow-up systems. So again, what surprised me quite a bit with Jessica, especially in the kind of first couple of appointments that I had at the vets, was that I wasn't encouraged to monitor or observe her progress. So I used my own initiative to actually continue to document and observe everything. However, once those samples came back from the lab clear, I was basically told there was no need for further exploration, which is a big mistake in my opinion, and also doesn't encourage pet carers to constantly be observing their animals, because as we know, these subtle differences are very significant for early intervention. So your dog might be okay today, but he might not be okay tomorrow. So it's just being aware that observation never stops, and especially when something suspicious has been suspected, to keep proactive in monitoring and tracking symptoms to make sure that nothing's missed. And I think that there has to be, again, a framework or something similar in place to encourage more pet carers to really be on the ball when it comes to the physical, behavioural and physiological symptoms a dog is displaying or an animal is displaying, and even having some sort of, I don't know, educational resource so that they know exactly what to look out for as well. Because again, as carers, obviously we know our dogs very intimately. We do pick up on subtle differences quite quickly, but it would be good to have kind of more of an understanding of where and what to look out for. Especially for kind of untrained pet carers. Obviously, it's different for us because we are in this industry and we will typically and most likely know what to look out for. So let's grab your notepad and pen again and let's take part in this quick poll exercise. So the first question for this poll is, do you know where your existing clients go to seek other pet care services in your area? A, yes, it's part of my onboarding process to get to know everything about the animals in my care. B, some of them, but only because they have referred me. C, I think so, but I'd only be guessing. And D, no, I've never thought about doing it. So again, obviously this just means that the significance of obviously understanding who else an animal is seeing, and making sure that they are synchronising your ethos and approach as well, so there's no conflict of interest there. And that's why it's so important to make sure that you are aware of what other pet care providers an animal in your care is receiving. So the next one is, are you aware of your surrounding pet care providers, and do you have a database of individuals that you trust and regularly refer to? So A, yes, I have professionals for every sector. B, kind of, I have some professionals for some sectors. And C, no, I don't concern myself with other pet care professionals in my area. And again, it's kind of feeding into that kind of idea that, that isolated approach to animal care. Like, I'm a groomer, so I'm sticking to my flock. And it's kind of broadening your horizons and stepping into, actually, wait a minute, we're all interconnected, and getting to know the pet care providers that are not only kind of on the same wavelength as us when it comes to our beliefs, but also the pet care providers to stay well clear of due to outdated beliefs as well is super important. So if you're answering kind of or no, I would certainly be looking at that as a key kind of indicator that you need to be kind of looking out into your local community and getting to know the individuals that are also providing pet care services to the community. The next question is, how often do you communicate with other pet professionals about shared clients? And again, this is tapping into that system that I was talking about, where shared information can be transferred easily to and from specific pet care providers that have shared clients. So whether that's like a weekly check-in, whether that's like a kind of designated WhatsApp group or something, or a weekly meetup or a monthly meetup, or if it's something along the lines of the bespoke grooming planner, which I've designed, that's the sort of thing that I am kind of referring to with this question specifically. So A, daily, B, weekly, C, monthly, and D, rarely or never. And ideally, if we want to truly achieve synchronised care, we are looking for this sort of thing to be happening on a daily basis with every single one of our clients. If we cannot learn to embrace one another's strengths, we can never truly step into our power to make life-changing differences. So again, like I say, we all have value to give. And it's about embracing that value rather than thinking, I'm more trained, so therefore I know best. So stepping away from that and actually seeing everyone for, the value that they bring to the table. So quite quickly then, what happens when we do not communicate? Professionals unknowingly or knowingly undermine another professional's advice, experience and or work, causing doubt in carers. A conflicting approach to animal care results in wasted time, lack of stability and the prolonged suffering of animals. Lack of opportunity to build a relationship with one pet professional for each sector. I'd even go so far as to say one or two pet care professionals. Obviously, it's not good to rely on just one person in, say, a vet clinic. It's worthwhile making the time to actually build rapport with one or two vets in your clinic or one or two groomers in your grooming salon, just so that you have got an option there should a person fall sick or be off on maternity leave or whatever it may be. Because failing to do that will build up carer frustration and also waste valuable time. Lack of communication between carer and professional can also prevent early intervention, thus leading to unnecessary prolonged suffering and even premature death. And obviously I want to emphasise that in Jessica's case, it was terminal. We weren't going to have long with her. But for me personally, those extra 6 months to a year, if we'd caught it at the time when I first started expressing concern, were significant to me. Like I would have gave anything to have an extra 6 months with Jessica. So to me, that I'm still classing as a premature death, right? Inconsistent pet professional support creates a build-up of carer frustration and confusion. I've just realised that that's kind of repeating lack of opportunity to build a relationship, so just ignore that one. Quick exercise again. So have a reread over these points and then see if you can think of any more potential risks in not communicating, whether that's carer and professional or professional to professional or both. Once you've wrote down a few things, we can move on to the next slide. So I wanted to share some scenarios of where a lack of synchronised care can hinder early intervention and treatment. So here's a grooming scenario. So the groomer notices skin irritation but doesn't communicate this to the carer. The carer notices more advanced skin problems a couple of weeks later, naturally blames the groomer and seeks veterinary advice. The delayed treatment and lack of communication between the carer and the groomer results in prolonged suffering of the animal, a lack of trust towards the groomer going forward, and also the vet thinking that the groomer must not really know what she's talking about because she never thought to raise concerns about the skin disorder that's clearly now there. As a result of all of this wasted time, there's a more chronic skin disorder to now deal with, and it's requiring a more advanced and long-term treatment plan. If the groomer had just mentioned her observations at the time, then the carer could have been proactive in visiting the vets and getting treatment before it advanced. It would have also helped prevent blame as well, because the groomer would have been proactive in saying, listen, I've noticed this. It wasn't anything that I did. I noticed this. Please think about seeing a vet for it. And the carer would be less likely to blame the groomer for it. For example, oh my goodness, the groomers obviously gave my dog clipper burn, which is possible, of course, but in some instances we get the blame and it's not actually our fault at all. But that lack of communication has escalated the entire situation. Okay, so here's a second scenario involving a dog trainer. So dog trainer works on fear-based reactivity using a positive-only approach. However, carer takes the dog to a conventional groomer who uses restraint methods in order to control an unruly dog during grooming tasks to prevent the dog from biting, right? So these two professionals have a conflicting approach. So one's more dominance based and one's more positive only based. And that results in a dog becoming more anxious. The behaviours then escalating and advancing, and no progress is then being made. This ultimately leads to the frustration on both parties. So Dog trainer's frustrated because she doesn't understand why our methods aren't working, or not working as much as she would have expected. The dog groomer is also confused because she's trying to obviously control the situation as per her teachings, and the dog's getting worse. And as a result, the dog ultimately suffers, and also the carer suffers, because the carer's then eventually probably going to be faced with, your dog can't be groomed safely, your dog's aggressive, try and find another groomer. So there's so much that can happen just because two conflicting approaches, right? And also conventional groomer and trainer and carer not all working together. So scenario 3, vet prescribes anxiety medication for a dog who's struggling to cope with day-to-day activities. The groomer is unaware that this dog has been placed on this specific anxiety medication. So the approach to grooming tasks are approached again conventionally and without consideration of the possible side effects that this medication can cause. For example, behaviour-specific changes. Ultimately, because there's no approach adaptation, behaviours escalate quickly and the dog bites. The groomer thinks that this came out of nowhere, doesn't understand the sudden change in behaviour. The bite is then reported to the authorities as per policy, and the dog's now branded aggressive and struggles to find an alternative groomer as a result. Obviously, the dog's not aggressive, and all of this could have been prevented had the vet and the groomer established a relationship, or if the carer knew that everything's interlinked, and to then relay that information to the groomer and let the groomer know, this is what my dog's been placed on, this is the potential side effects, just to make you aware. Okay, so again, it's just that disconnect. We must stop working against each other out of fear of competition and start truly embracing working with each other in the pursuit of progress. Now, I wouldn't say that it's competition per se when it comes to a groomer trying to find and establish relationships with vets and other pet care providers. You see competition mindset more between professionals of the same sector. However, it's a really good point to make while we're here anyway, because I do think that it's still imperative for us to also expand our network when it comes to the same sector as well and step away from this competition mindset. I don't think that we're in an industry where we have to worry about competition because there's that many dogs out there, and not all dogs are for everyone. So there's been occasions where I've referred dogs on to other groomers, for example, because my environment's maybe not suitable, or maybe the dog just doesn't click with me, or maybe I'm feeling poorly and I work as a one-to-one groomer. So in order for me to refer clients, I need to be able to trust other groomers. So again, having that network of professionals within the same sector is imperative for me as a solo groomer. But equally, we have to step away from this, mine mentality and our ego as well. And that if we refer on, what might that kind of look like on the outside? It might make us look less credible or less experienced, when in reality, it shows more professionalism, being totally transparent and also being open to the idea of working with other professionals. So we're stepping now into the 6 pillars of synchronised care. And I believe these 6 pillars are going to help to address the things that have went wrong. Things that went wrong with Jessica's case, but with probably many more dogs as well. So we've got shared language, aligned approaches, unified goals, information flow, coordinated timings, and pet professional stability. Don't worry, I am going to go on to explain each of these now. So we need a shared language. That's the first thing we need to pick up on from this story. If I say that a dog is showing reluctance for grooming when they've normally really enjoyed it, other pet care providers must understand the significance of that. Now, obviously in Jessica's case, that didn't happen, and that resulted in the dismissal of my observations. It wasn't until there were more obvious physical ailments, I kind of shown, that the vets began to take my suspicions seriously. So, for example, the blood speck and the blood count in the urine. When a trainer, for example, says, displacement behaviour, it would be really good if the groomer understood what that meant as well. So there has to be a language there that all pet care providers understand and know. If they say, for example, that the dog's been put on a desensitization plan, or if the carer says to the groomer, the trainer's put the dog through a desensitization plan, and the groomer has to be, savvy enough to say, well, can we please have permission to contact your trainer so that we can establish what that plan is and see how we can contribute to the progress that your dog makes, rather than work against them. So we don't want to obviously do anything that's going to set the dog back, right? So we have to be more proactive in our ability to have that kind of foresight and saying, right, how do we make this situation better rather than hinder it? We also need common terminology that's not only accurate but up to date as well. So we see a lot of outdated terminology used from outdated mindsets and beliefs. So, for example, the dog's being lazy, the dog's being spiteful, etc. It's not accurate. So again, we're trying to educate other pet care providers, but are also trying to educate pet carers on the words to use and why the other words that are commonly used to describe more significant behaviour cues are wrong or outdated. So say goodbye to aggressive, because that's one that I'm sure you can all agree is commonly misused and overused time and time again. The amount of dogs that I get referred to me with like capital letters, dog's aggressive, bite risk, muzzle, blah, blah, blah. It's scary, whereas we need to know the difference between fear-induced behaviours and fear, just in general, and aggression. So again, that's something that we have to think about. And at the very least, we should be trying to remove jargon when we're talking and communicating with carers as well. So we don't want to confuse them. We want to keep things very, very simple. We want to also tap into their compassion as well. So saying things, rather than saying your dog's reactive, we could say your dog's sensitive to this. And it's just that kind of change of phrase that can be really, really significant in changing a person's mindset when it comes to how they view behaviours and deem behaviours as well. Okay. Information flow, as I've already mentioned, we need a proper information flow that is ethical and allows pet care providers to relay information quickly and efficiently, while also taking into consideration privacy as well. So we have to come up with something. We have to come up with something that allows us to all connect with one another and make sure that we're all working together effectively as well. So some sort of secure system or protocol for quick reference, as I've said, and also making sure that we seek carer consent as well to make sure we're not in breach of any kind of data protection laws. It will allow everyone to stay up to date and also be aware of any adaptations that have to happen in order to really provide that dog with the care that he or she needs at that given moment. Aligned approaches, again, I've already tapped into, but we have to make sure that everyone that's working with an animal is consistent in their mindset, their beliefs, and their approach. So we can't have a dominance-based trainer working alongside a holistic HGA approved groomer. It's just not going to happen. It's not going to work. We're going to have various roadblocks in the way. It's just going to prolong the suffering of animals longer term. It's not going to be able to address any of the issues that we're trying to relieve or resolve. So we have to start thinking about an updated and positive only approach when it comes to care. And if, for example, you get a client through the door, you need to be proactive in asking who the carer's seeing out with. Grooming, for example. So does your dog attend regular training sessions? Does your dog attend doggy daycare, dog walker, whatever it is, and get to know who these individuals are so that you can be sure that they're receiving a good, updated and ethical approach to care. And if they're not, you will hopefully at that point have a database of professionals that you trust that you can subtly and very sensitively refer to. You can also entice carers in on that note by establishing some sort of affiliate referral scheme with other pet care providers, so that you can then say, do you know that we actually work really closely with so-and-so down the street, and they are actually offering any of the clients that come through me 10% off, or something like that. If you can negotiate something like that with all of the people in your trusted network, even better. Unified goals again. So again, it kind of falls into the aligned approach topic as well, doesn't it? We want to look at what the animal needs rather than what we expect. So we're not looking at the end result. We're not sprinting before we can crawl. Okay, we're looking at the small kind of like tiny little goals and steps that we need to make in order to reach the end result. But we're looking at the journey rather than the destination. We're not looking at quick fixes because that makes our social media look good. Now it makes us look credible, because if we look at the quick fixes, typically speaking, longer term, they're not going to last, right? So we're looking at the slow burn approach. We're looking at setting really strong foundations in order to have long-term success. But everybody has to be on par with that. Everybody has to reinforce that approach. You couldn't have like a vet saying the groomer's wrong for doing this, she should have done that. Everyone has to be on the same wavelength. Everyone has to strength in numbers, as was it together we are stronger, as PPN says, and it's so true. We have to all stand up for each other and be that strong voice of reason on behalf of the animals in our care. Coordinated timing, again, specific to synchronised care, is to do with strategic sequence of different services. So, for example, if I take, say we have a rescue dog that comes from China who's incredibly anxious, as would be expected, we wouldn't then say the first thing that dog needs is a groomer, all right? Unless obviously the dog's experiencing significant and severe matting, which would then be a vet referral anyway. Grooming's not the first thing on your mind, right? The first thing on your mind is vet visit. Let's make sure this dog is not unwell. This dog doesn't need medical assistance. Then the second kind of step probably would be a behavioural expert on rescue specific cases, all right? We want to make sure that this dog's psychological and emotional health is where it should be. Then we will look at things like grooming, but that's not to say that a carer couldn't be proactive in finding all of the professionals for their dog and having that network of professionals working together from day one. That's absolutely possible and probably is recommended as well. But it's to do with being very, very sure of what comes first and not being too quick to jump to the more advanced and strenuous activities just because it suits us and is convenient for us. So as I've said there, maximum benefit for the dog rather than maximum convenience for us. Yes, it would be lovely to have a rescue dog all bathed and smelling lovely, trimmed to breed perfection, whatever breed mix it may be. However, it's not of benefit to that dog if the dog's suffering. All right, so we need to think about coordinated timing. Pet professional stability, as I've said a million times already. We know from Jessica's story that consistency is really the key factor here. Having to keep repeating history, having to keep trying to build some sort of rapport and relationship with pet providers is not going to allow us for early intervention. We have to start looking at building up trust between pet professional carer and animal. We have to make sure that in order to basically have an accurate assessment of a dog, that person responsible for caring for that animal must get to know that dog more than just one-off assessments here and there. All right, so even if it means starting to integrate kind of bonding sessions, so I do that a lot with my clients, and I recommend and encourage students of the HCA to also incorporate bonding sessions with dogs in their care, because having that opportunity to just have fun and get to know the dog through whether it's ACE-free work, which we're going to talk about in a wee second, is really vital for building up that familiarity with a dog and starting to recognise any kind of changes to behaviours and things as well. So again, it's going to help make early intervention possible. And just to kind of put it into perspective, this is just a made up interconnected network of professionals. So we've got Bruno's vet, Bruno's registered veterinary nurse, so that's 2 professionals from the same practice. We've got Bruno's groomer, Bruno's Gallon myotherapist, Bruno's behaviourist, and Bruno's carer. And as you can see, all of them are positive only in their approach. And those wee dotted lines just signify that they're all communicating and talking to one another. So that interconnected network, one team, one voice, simple, one goal. All right. So let's look then at a case study and how I know that this sort of synchronised approach does work. I want to talk about Harry, the Springer Spaniel. So at 5 years old, he'd been labelled as lazy and stubborn by his former groomers. And as such, there was also a note on his case file to say that he was a moderate bite risk, especially when attempting to lift him into the bath or on the grooming table. So obviously, instantly when I read this raises a red flag. Okay, so he's a moderate bite risk, particularly when trying to be lifted. So my first thing that I'm thinking is there pain? So his carer came to me after coming across some of my videos on social media. So when I was kind of more active with my grooming, I used to post like videos every day. I was very transparent about how I operated behind the scenes, and I would share exactly what was happening. And people loved that. They loved to see this unorthodox approach to grooming. It wasn't like traditional grooming where dogs were hooked up to grooming tables. It was a completely different setup. And that's what really pulled Harry's carer in. She felt like that was the thing that had been missing that Harry really needed. So she came to me after seeing a few videos. So the first step in my process is a phone consultation. Now that can last anywhere between 20 and 40 minutes, and I ask every question I can think of. I really want to know what makes Harry tick, who is Harry, and basically expectations as well from the carer. So we had a conversation, and then after that we arranged for a meet and treat, which is this picture here that you see. So a meet and treat is something that I do for every single new client, and it's also what every HCA graduate will do as well if they're doing things the right way. A meet and treat is an informal, non-invasive appointment where you just simply observe. It's crucial. So you get to know the dog from a distance. If the dog initiates contact, even better. But you're basically there to pick up on any signs of behaviour or any indication that there's something causing the dog disease, or in the ideal case there's no issues at all and the dog's very confident, very friendly and whatever. But either way, regardless of whether the dog's got a history of being anxious or not, a meet and treat is essential. So this here is what is referred to as a free work session. So if you're familiar with Sarah Fisher's work at Telly Farm, then you'll know exactly what I'm talking about. It's a range of obstacles with various different kind of treats and things hidden, basically to encourage the dog to move, to explore, to rummage, to forage, to whatever. And all the while you're making notes. So within basically 5 minutes or so, it couldn't even have been that, I noticed very quickly that Harry had an uneven weight distribution. He also was struggling so he'd lay down at one point on the mat there, and he was struggling to get back up. So instantly could see that there was discomfort there. When I expressed those concerns to the carer, she was surprised. She's thinking, Harry's only 5 years old. He's, should be in his prime. However, what we know now, based on research from CAM, is that up to 35% of dogs under the age of 8 actually are already suffering osteoarthritis. We also know through the work of Dr. Edward Brassensthwaite that the majority of dogs are struggling with silent pain, which is neurofascia pain, soft tissue pain, pain that's undetectable through conventional modes of testing at the vets. Significant fact there for you. And as a former holistic therapist who specialised in kinetic chain release, I am particularly fascinated with silent pain. So yeah, there you go. Something else about me that you probably didn't know. So it just really made me sad that obviously Harry had been classed as lazy when to me, it was obvious that he was struggling with some sort of mobility issue. Now, obviously, again, we have to be careful on not diagnosing or advising a medical treatment. So all I said to the carer at that point was, the first thing we need to do before any grooming takes place is have Harry thoroughly assessed by your registered vet. And if you would give me permission to contact the vet as well, just to let them know who I am, that would be fantastic. So that's what we did. Not long after the vet appointment, Harry was placed on a pain med trial with suspected hip dysplasia. So that was that. We then began with very short grooming appointments. So none of my appointments lasted over 30 minutes. All right. So it was basically very, very gradual in our approach. At that point as well, I did recommend that they try hydrotherapy as a natural way of trying to alleviate some muscle tension and whatnot as well. So that was something else that we began to integrate. We worked on cooperative care. So rather than the conventional approach that Harry was used to, where he was getting lifted onto grooming tables, etc., made to stand for long periods of time, we completely changed the approach. To be honest, it's my standard approach anyway, but we changed the approach for Harry, and Harry then thrived. So around about 6 months later, we had a totally different Harry. Harry was getting around a lot easier. He was really enjoying grooming, as you'll see in just a second. And we had a very happy carer as well, who had not only managed to, say that her dog had overcame the kind of grooming related fears that he once had, but was now a lot more comfortable in every kind of sort of day-to-day activity as well, because he had early intervention. So there you go. Here is a video of what I'm talking about with non-conventional approach to grooming. So this is a walk-in shower. Where the camera's sitting here is completely open, so Harry could leave. He could step out safely whenever he chose to. He never ever chose to leave. He actually thoroughly enjoyed being pampered in the end, which was fantastic. It's a really rewarding feeling to see a dog overcome his fear of grooming. So this is Harry. Here he is again, getting dried. And like I say, we're not making Harry stand. We're letting him really just chillax. There's a nice comfortable mat underneath to just help him with his joints. I've got actually workers' trousers with integrated knee supports, so that I'm not obviously hurting my knees from kneeling as well. So everything's made to adapt to the dog's needs. And as you can see here, he's just absolutely loving life right now. Absolutely loving life. And here are two other parts of the process as well. So here we have a thick yoga mat for comfort, and the door to the garden is open at all times so that he can get a wee bit of a breeze, but also step out if he wants to have a toilet break or just a rest break. But if you keep watching this, he does end up just lying down, conking out. He actually just ends up sleeping. There is actually a part in the clipping video that you might see. I don't know how far into it is, but when I go over his hip, you'll see the behaviour shifts subtly change. So he'll turn around, he gives you a wee bit of a whale eye, and he does a tongue flick as well. And that just indicates, obviously, there is a wee bit of discomfort there. So again, it's really it's very, very subtle, but it's very interesting to watch it back and actually pick up on it, because obviously at my angle, I probably wouldn't have picked up on that at the time. Although the good thing is that I'd already picked up on it during the meet and treat, so it was fine anyway. But it's good to have this sort of footage in order to demonstrate and express your concerns with evidence to support for the carer or other pet care providers as well. So as I said, 6 months after really working with them, experimenting with the different kind of pain medication and whatnot, we managed to get him in a really good place. And this was basically his experience of grooming from that moment on until I went on maternity leave, unfortunately. But there you go. Harry is not lazy. Harry was just struggling and not able to express that he was struggling in a way that other pet care providers could understand. So there you go. So let's now look at our next integrative Interactive poll exercise. So in the last month, how many times have you proactively contacted another pet professional to coordinate care for a shared client? Now, I'm not talking about emergency intervention, right? I'm not talking about, oh my God, I have just clipped Harry's ear off and I need to contact the vet immediately. I'm talking about just for the general kind of updates on how things are going, right? So A, 0 times, B, 1 to 2 times, C, 3 to 4 times, or D, 5+ times. Now, if you're saying A or B, you're probably in the majority. Most pet professionals do not communicate with one another unless they have to. Do you not just think as well, like, I think COVID has a lot to answer for, because while online, we seem to have like built our network. Like, I've got tons of people all over the world who I absolutely adore and love and respect, but I've got very little in my actual local community. Like, there's so much more I could be doing as well. So I'm sitting here preaching, and I should be doing more in my own community, admittedly as well. But it's kind of made us afraid to step out and actually introduce ourselves. So I want us all to make a kind of conscious effort now to get out there and actually introduce ourselves more. And if there's no professional networking events happening, then make one. So we're wanting to aim for 5+ times, right? We want to make sure that we're constantly updating records and sharing information that's significant with other pet care providers responsible for an animal in our care. Second poll question is, how many pet professionals in your area do you have genuine working relationships with? This is people that you could call right now about a case and they would take your call seriously. So if, for example, you had an animal in and you knew that they saw this other professional and you were a bit concerned about something, you'd phone them up and say, listen, can I have a quick conversation with you about Snoopy? They would be like, absolutely. All right. 0 professionals is A, B, 1 to 3 professionals, C, 4 to 5 professionals, or D, 5+ professionals. If you are an A or a B, then you're essentially working in isolation, and that needs to change, right? We need to up our game here. We need to be aiming for at least 4 to 5 professionals, if not 5+. Okay? When was the last time another professional asked you for your input on a case or took action based on something that you observed? I will be honest and say that I think it's more common for the likes of behaviourists, trainers, and vets to receive questions from groomers than the other way around. I do think, and I'm not just playing the martyr here, right, but I genuinely do think that groomers get it the worst when it comes to our credibility and value. And I can understand why that is. All right, so I preach, and if you know and familiar with my work, then you know that I preach about how our conventional training just isn't good enough. We are not receiving the training that we ultimately need in order to be valued assets in a professional care team. But the HCA is all about enhancing that and making groomers more equipped to deal with things that are more specialised. So I would say that if you're a groomer watching this, you're probably going to say D over a year ago. If you're an HCA groomer, you might actually say maybe A, B, or C. All right. But if that is the case, what can we do to put ourselves on the map? All right. How do we position ourselves as a person to listen to? And it doesn't just fall on the responsibility of the individual that's not being listened to. It also falls on the responsibility of the people that are not listening. All right. So it's starting to identify, again, like I say, that we all have value. And actually, I would say that groomers are in a fantastic position to offer insight because of how intimate our relationship with dogs is, but also how regular we see them, or a typical dog. So it could be anything from every 4 weeks. If it's an HCA groomer, you could be looking at every 1 week, every 2 weeks. It's at maximum, 4 or 5 weeks, I'd say. For a more conventional groomer, it could be every 2 months to 6 months, depending on the breed. But either way, we typically tend to see dogs a lot more frequently than any other pet care provider, especially on a longer term basis. So again, thinking of that and how significant that is, groomers are a fantastic asset. So the last one is, do you have established systems for sharing important observations with other professionals? Now, again, if you're an HCA groomer, you'll probably have the holistic grooming planner. So the answer would be yes. However, if you're not, you might not have a system, but you might. And if you do, that's fantastic. But if you're not, then you have to think about that better, because if you're relying on your memory and, oh, I might remember to mention that the next time I see so and so, then you're risking information not being passed on quickly enough. So we have to be getting into the habit of constantly updating records and sharing and having those records accessible straight away. So again, like I say, if anyone wants to work with me in a potential system for this, please reach out. Finally, in the last 6 months, how many cases have you worked on where multiple professionals were actively coordinating their approaches with you? A0, B1 to 2, C3 to 5, or D5 plus. And again, we want to aim for 5 plus. But if we are looking at like 0 to 5, then it's not good enough. We have to be really aiming for synchronized care, working together as part of a bigger team in order to look at the bigger picture. So the goal here is to have 100% of your clients receiving a collaborative approach from a pet care network that you've put together and that you trust, right? And if you don't know a specific professional and the carer's not willing to change professionals, obviously that's not really that ethical as well. You don't want to be going, oh, you don't want to go with her, go with my guy or whatever. What I would be saying is that's a challenge for you to then establish a new relationship. And it's a good thing, and it can only be a good thing. So if a client has another pet professional that you're not, too kind of familiar with their work, reach out, go and grab a coffee, get to know them, and hopefully form that relationship with them as well. Expand, right? The more professionals you have that you trust and that you can obviously work with and rely on, the better, not only when it comes to efficiency, early intervention, and preventing prolonged suffering of animals, but also for your emotional support network. I'm going to plug Tamsin Durston's amazing book, The Animal Welfare Professionals Emotional Support, because her book highlights the real issue that we have in burnout and compassion fatigue, and it kind of focuses more in the veterinary world, but I do think it applies to all pet care sectors. We are all really struggling with our mental health, and I think that having this network's not only good for the dogs or the other animals that we're treating or caring for, but it's also good for us to have somewhere to vent and trust that information's being kept private and confidential as well. So it's also going to help with our own mental health. So it's really important. If you take away one thing from this, it's that. Finally, we just want to briefly tap into the SHARE system, which I've put together for ease of remembering, really. So SHARE is an acronym, and it stands for, well, the first one, let's look at the first one, significant changes observed. So getting into the habit of noting down observations. Now, what I do with my students is I tell them to record as much as they can. So whether it's photographs or videos, ideally videos, but if you're constantly videoing your sessions, then you're going to pick up on subtle changes, and subtle changes can be significant and most likely will lead to more significant things, right? So we're getting into the habit of observing everything. We're documenting everything. That's the first step. So for Jerry, it was struggling to get up or turning his head, averting his gaze, whale eye, lip licking when he was touched around the hip region. For Jess, it was a sudden change in her tolerance to grooming tasks when she used to absolutely adore grooming tasks. So, it might not have been as significant if it was another dog, but to her, it was significant. The next one's H, so handover information provided. So information is pointless unless you are sharing it with the individuals that need to see it. So don't just note it down for yourself, which is what a lot of groomers do, and probably a lot of other pet care providers as well, is note down those kind of changes for the next appointment so that you're aware of it, or so the next groomer is aware of it if they're in that day. That's not good enough. We have to be relaying that information to other pet care providers in our network. Okay, so that's where that system comes in. The next one is action plan coordinated. So as I mentioned already, we have to have a plan that's consistent, where everyone's working towards the same goal and where everyone's contributing rather than conflicting against. Okay, so again, it's being realistic with our expectations. It's about thinking of what's of benefit to the animal rather than what's convenient for the professional, and we are all on the same wavelength. So again, communication is key in the action plan coordinated. And again, that action plan is going to change as well and adapt as the dog progresses or if the dog has a setback. It's things as well like telling the carer what to look out for. So, for example, if they were at the local dog park and they happen to get into an altercation with another dog, that's significant. And that would probably adapt the next few appointments. It would also mean probably that you would want to schedule in or reschedule an appointment to a later date. So we know obviously that in general, typically it'll take about 72 hours for the dog to calm down after a significant high stress event. So if the dog was attacked on Wednesday and you had a grooming session the next day, you would be looking at wanting to reschedule that at least 72 hours after, sometimes longer, depending on the dog. So again, it's things like that as well, keeping that in mind. That's significant. I would be phoning as a carer to let the groomer know this has happened. What do you want to do? All right. Then we have, I'm just making sure that I'm not forgetting anything because I've got a few notes here. So regular updates scheduled. So again, it's not just about, documenting one session or thinking that has reached our goal. We can stop updating the records now. We have to get into the habit of constantly updating records, right? We can't just stop because we think we've achieved what we've been kind of looking to achieve that whole time. We want to keep going with observations because obviously things can change in a heartbeat and things will ultimately change anyway. So we need to just keep everything up to date at all times. And then obviously that ties into the evaluation and adjustment of treatment. So again, we are providing a fluid approach to care that's constantly being assessed, reassessed, evaluated, and adjusted accordingly. We are never going to get comfortable doing one thing. We're also going to look at approach and how it evolves as well over time. So as science evolves, our approach will evolve. We know just by a simple glance into the dog training community how quickly things would change. So again, it's being aware of that. So everything's fluid. It's consistent, but it's fluid. And we have to be careful not to mix those two things up. So that is the share system. And I hope you appreciate it because it actually took me ages to come up with it. I mean, I'm quite chuffed with it. So yeah, there's no better way of achieving life-changing results than by changing your mindset from I to we. And this picture here, I absolutely love this picture because this was Jess in her prime. This was after one particular grooming session. She was that comfortable with grooming that she would even let me put in little hair accessories and things. She looked like Pocahontas in this photo. It is probably the closest I've had to being more aesthetic inclined in terms of making her look pretty because I could get away with it because she was so good at being groomed. So you can imagine how heartbroken I was when she suddenly just stopped caring about it. So yeah, that's wee Jessica there in her prime. Of course, I've started this presentation off on a real downer, really, but I want to end the presentation on a more positive light because, if anything, I really just want to honour Jessica's memory by initiating a movement where things change for the better across all sectors because synchronised care is the way forward when it comes to improving animal welfare standards. There's no doubt about it. Hopefully, this is just me preaching to the choir anyway, but if you're not too familiar with the concept of working together, if you're a wee bit afraid of the idea of working together, I'm hoping that this presentation today has totally shifted your mindset and made you feel more inspired and motivated to get out there and push past your social awkwardness in order to actually expand on your network because it is so crucial. I would say that this is something I've been passionate about since, starting business. So I started a business when I was 17. I've never looked back. And networking's always been like a key and core element to my business. For all my business models. So it's something that I really do hold like close to my heart. But when obviously Jessica passed away, it became all the more apparent that this sort of approach needs to be integrated into our sector specifically, because it's just not good enough, the results we're getting. So to summarise, basically my views of synchronised care and the pet industry, the pet care industry specifically today. Every observation matters. Every professional's expertise should be valued. Every pet carer's concerns should be respected and listened to. And if that happens, animals will then be able to receive coordinated care, and every concern will be taken seriously, and early intervention will be achievable. If you embrace this approach, you're going to be part of a culture that directly benefits the animals in your community. So we're so good at, trying to improve standards out with our community, with our online space, as I've mentioned. Like, we're doing a lot of good by getting the word out there across seas and things like that. But we're not, I think COVID's kind of got us into the habit of looking out rather than looking in. So if anything, this presentation is all about looking in and seeing what direct impact you can make to the people directly around you, your local community, and how that's going to enhance your reputation locally as well. As a result of that, it's about the bigger picture and the kind of immediate change that you can create by integrating this approach. So if you're interested in learning more, I am available to chat anytime. I'm actually also in the process of publishing a mini course which will be diving deeper into the share system and also the 6 pillars of synchronised care. So I'll be putting together a range of different templates, different exercises and activities to start implementing into your business, to start encouraging that synchronised care. And also just dissecting the topics a whole lot more as well. It's going to probably be available for £69. However, for PPN members, you can get it for £49. It is available to pre-order. We're hoping to launch it on the 7th of October. It might take a wee bit longer, knowing me, because I continually add things to things and I can't stop myself from doing that, but we're aiming for the 7th of October. If you are interested in that, just email me with the email address that's on the screen there, and I can send you the special discount code to get it for £49. You get lifetime access to it. It will continually get updated. It is what it is. No pressure to sign up. I'm sure that the information within this presentation is probably thorough enough. I'm not a really good sales pitcher. If you're interested in learning more about the bespoke holistic grooming planner as well, it's actually available on Amazon. So if you want to have a wee nosy at what's in there, you can. It has actually been designed for all pet care providers. Even though it says holistic grooming planner, it's actually